Hello, everyone. My name is Dr. Narjust Florez. I'm a thoracic medical oncologist at Dana-Farber Cancer Institute and an assistant professor of medicine at Harvard Medical School. Today, we're going to talk about survivorship. This will be a journey from diagnosis all the way to sexual health and cultural differences when it comes to survivorship. It's important to mention I'm a lung cancer doctor, so a lot of the things I'm going to be mentioned may be specific to lung cancer, but they can apply to patients with all different types of cancers. So I'm going to be sharing my screen quickly, and that way we can talk about some of the information that I will be sharing. All right, so as we mentioned, we're going to talk about cancer survivorship from sexual health to side effects management. These are my disclosures. So cancer survivorship focuses on the health and the well-being of our patients with cancer. And this is important to mention that cancer survivorship starts the day of diagnosis until the end of life or the end of the journey. Even if your patients are no longer meeting with their oncologist and they're only meeting with the primary care doctors, they still will continue to face issues of survivorship related to cancer treatments. Cancer treatments go from chemotherapy, surgery, radiation, and all of them have long-term consequences. It's important to mention that there's aspects of lung cancer or cancer survivorship that are unique to physical health. Scarring, changes in shortness of breath, the absence of breast. For example, if the patient had a breast removal surgery, also skin changes if the patient had radiation. But what affects the physical aspect is also what is important to patients. So some of my patients, hair loss is significantly, is very distressful. Some other patients may not be. And that's a common theme during this conversation, is that what is affecting the patient's survivorship, it all gets affected by the patient's lenses. Mental health in some cultures, mental health tends to be very taboo. I'm a Latina, and mental health is not something that is very spoken in my culture. So patients can have consequences of the cancer treatment to mental health, and that's really related to how they see mental health. Is mental health seen as taboo? Is something that's often discussed with their providers. Emotional aspect. There are two aspects of cancer survivorship that are very unique when it comes to the emotional part. One of them is the survivor's guilt. The survivor's guilt is very unique to patients that have early disease cancer or patients that are doing very well, in which they may have a nucleus of other patients, and unfortunately, their friends or colleagues or neighbors that also have cancer die to the cancer, and they remain alive doing well. So they often feel guilty for doing well compared to other patients. And this also related to healthcare beliefs. A second aspect of emotions, they change as the journey changes. So at the beginning, a lot of patients may face a lot of anxiety, then followed by depression, and then followed by more anxiety as they continue to have frequent CT scans to evaluate how the cancer is doing. The financial aspect also changes, and also changes based on the patient capacity. Is the patient working full-time? Is the patient in disability? That will affect the important aspects of financial survivorship. We need to talk about it, because at the beginning, a lot of patients may have financial help from families, from friends, but eventually that financial support may disappear as they move to different phases of survivorship. And also, this is a very important aspect of cancer health disparities. For marginalized groups, people of color, financial toxicity is significant as they don't have the same resources that other groups. Social aspects of survivorship are very important. For example, in the Hispanic Latinx culture, the family nucleus is very tight, so patients may have a strong social support. In other subgroups, patients may not have this. And we live in a society in which independence and individuality is praised, but when it comes with cancer survivorship, having a very strong social support is related to patients have a better outcome. All of these aspects will affect our patient survivorship. Patient's comorbidities, how well is the patient doing? Social support, is the patient married, single, or widow? Does the patient have children? We also affect patient's survivorship. Geographic location, how close are you to your cancer doctor? Do you have to take multiple lines of transportation, like a bus and a subway, to get to your cancer doctor? That affects survivorship, and we often forget. Socioeconomic status, do you have access to your medications? Do you have access to preventive services? all risk reduction services like mammograms, pap smears, primary care services. Also, what are the remnant symptoms from the cancer? Even if the cancer has been treated, can have remaining symptoms, shortness of breath, scarring tissue, like we just talked about it. So, what are those one of those cancer-related symptoms? What are the side effects that are remnant? And patients with chemotherapy, neuropathy, which is tingling sensation of fingers and toes, can remain. It can be very detrimental to a patient's survivorship experience or quality of life. Also, schedule burden. So the patient has many appointments that they have to continue to come to the cancer center or to the hospital. That will affect the patient's schedule burden and survivorship. One of the important things that we need to talk about is like who is responsible for a patient's survivorship experience after a cancer diagnosis or during cancer treatment. It's important to mention that survivors, even patients with stage 4, they're all survivors, and we cannot exclude any patient and should not exclude any patient. The responsibility about survivorship is everybody's responsibility. It's the medical oncologist, the radiation oncologist, the surgeon, the primary care doctor, the OBGYN. We know that we're all responsible for our patient's outcome. And another area of survivorship that we often forget is that nurses are also very involved with survivorship. Primary care should be involved with survivorship, particularly as the patient continues to have more and more extended visits with the medical oncology team or with their surgeon. Then the primary care doctor tends to have a more higher level of responsibility. And that's what is very important, that we all work as a multidisciplinary team. So what multidisciplinary team means? Multidisciplinary team means is there's doctors and other members of the team of several subspecialties that we all work together to assure that our patients are doing well. So we know that multidisciplinarity improves care coordination, leads to a better patient experience, and reduces the variation of care. A problem in lung cancer and other cancers management has been identified as when people are working in asylums. Particularly in the face of survivorship, it's very important that we all work together. And the benefit of multidisciplinary care is not only in the United States, but has been described to be beneficial worldwide. What are some of the tips when we talk about the different cultural perceptions of survivorship? My number one tip is patient education. Patient and caregiver education. Survivorship can be seen in several layers of care. The medical aspect, side effects of chemotherapy, surgery, the psychosocial aspect that varies from one culture or one person to another. What kind of social support do you have at home? How do you see cancer survivorship? Can be seen in different lenses. Attitudes and beliefs, as you can see, it covers a lot of these areas. For some patients, how they see healthcare is very different to others. And it's very important that we understand differences and we treat and follow our patients based on their healthcare beliefs. No, everybody sees health the same way, and not everybody appreciates things versus the other. And also communication preferences. For patients that may not speak English as the first language, it's very important that we use interpreter services, even when the patient is not getting chemotherapy, even when the patient is not getting radiation, because using the preferred language, we assure that the communication is adequate, and also we assure the patients receive all the information they need. Something that we recommend people to avoid is to use your family members as a translator. It's important that the family member is present to understand the information, to kind of help the patient understand the information at the moment and later when they go home. When we use a family member for a translator, then the family member will be busy using, providing the translation services and not really listening. Something important when we talk about survivorship is the early integration of palliative care, particularly patients that have metastatic disease, meaning the disease has traveled to another organ. There are cultural differences in how you see palliative care. Particularly with the Latinx Hispanic community, there's a perception that palliative care means end of life, which is not true. Palliative care are the symptoms doctor, and we have seen a movement in which we are changing the name of this from palliative care doctors to supportive oncology doctors to help patients understand. Symptoms doctors are very important when we try to support our patients in survivorship. They have dedicated time to treat with symptoms. They have a lot of training in these areas when it comes to symptoms control compared to other doctors. So it's important that we integrate the symptoms doctor or the palliative care doctor early in their journey, and that we explain what is the goal of this. Side effects are changing. Before, we only have chemotherapy. Now we have targeted therapy. Now we have immunotherapy. These graph here are all the potential side effects with immunotherapy. There is no organ that is no clear or safe for immunotherapy. So patients should know that whatever they thought or what they're associated with their treatment may be very different as we are using newer therapies like immunotherapy and targeted therapy. It is important that we manage the side effects based on the patient's belief and what the patients prefer. For example, for targeted therapy, the side effects are very different to what we understand for chemotherapy, meaning patients have more rashes, they have nail changes, they have chronic symptoms like diarrhea, and diseases like interstitial lung disease. So educating our patients and for them to verbalize to us and feel comfortable which side effects are affecting the survivorship experience or their quality of life is very, very important. Also, we need to understand what aspects of these side effects are affecting the most and target the ones that are affecting the most our patients first. I have a patient in which the diarrhea, even what it would consider to be a grade 2, was affecting her quality of life. She was very worried about using public bathrooms. Again, it's associated with her care belief. She didn't want to use public bathrooms, so we really focus on the diarrhea. So she can go out with her husband, have dinner, and be out there instead of being worried where her next bowel movement is. She had other side effects from the therapy, but what was important to the patient was to control the diarrhea. So we need to focus on what is important to the patient because is their cancer experience, is the survivorship experience. While we know that, low platelets can be more troublesome for treatment, my patient was not complaining about low platelets. She was complaining about the diarrhea and how it have affected her quality of life. It's important that patients are aware of severe side effects. Like in this case, heart failure can be associated with some of these targeted therapies. Survivorship is very related to our patients' experience with the doctors and the information that are provided. So often, because my patients may be taking a pill every day, they forget that it is cancer therapy, that's cancer-directed therapy, and that side effects will occur. So not only talking about the general side effects, but talking about the severe side effects, these ones are very important that we catch early, and also to understand the side effects can happen during any part of their journey, at the beginning of the treatment, at the end of the treatment, right in the middle. Some side effects for local therapy, like lorlatinib, can be very severe, even if the patient is only taking the medication once a day and is a pill. So they can have high cholesterol, high triglyceride, but I wanted to pay attention to the other side effects, which is hallucinations, visual, auditory, olfactory. They can have effects about their mental status. So patients should be trained or should be educated that even if they're taking a pill for their cancer, they can have severe side effects. And why is that important? Because sometimes our patients may feel like, oh, it's only a pill. And I may not require follow-up, but some of these pills can be very, very toxic. So having an open communication and understanding what is your priorities for your health is very, very important. Something that we need to talk about it is caregiver education. Patients' healthcare beliefs are also associated with how involved their caregivers are. Some patients really want their caregivers to be involved. So those patients' caregivers should involve in all discussions. For others, they want to keep things private from their family, and that should be respected. It is important that we follow our patient's healthcare belief and cultural belief. Sometimes patients don't want to disclose anything to the family. So I ask open-ended questions. So what are you afraid of that your family may know? What can I help to improve the communication? So there is two ways, caregivers can be involved as much as patients want, or they can not be involved at all. And it's often important that we continue to reassess how much you want your caregiver, your wife, your son, your daughter, your neighbor to be involved, how much they want them to know. Because patients' opinions and perceptions will change over time during their survivorship. And I cannot stress that enough. Patients, we change their mind. The situation we change. A diagnosis, they may have a very good performance status, and that we change. So we always have to have an open communication and address how much the patients want the caregivers to be involved. A very important aspect of cancer survivorship is financial toxicity. Patients that are diagnosed with cancer are a higher percentage of having bankruptcy, to have to deplete their entire savings for this. And this is very related to access to healthcare, it's very related to insurance, it's very related to any savings. And also for younger patients that are diagnosed with cancer, they often don't have life savings, they have other responsibilities like young children. So younger patients are particularly at higher risk for having significant financial toxicity from cancer. Now I want to tell you a story. Why do I focus on younger women with lung cancer? Everything started with a patient I saw during my days at Mayo Clinic. I met with the patient for the first time. I was still a fellow or a trainee, so I was training to be an oncologist. And I remember disclosing the results of the biopsy in which she was diagnosed with lung cancer. The first thing she told me was, please do not tell my family. She didn't want the results to be disclosed. At the beginning, I was a little bit shocked because most of my patients come to their family to get support during these very difficult times. But this patient did not want their family to be involved. She was afraid of the stigma that was associated with lung cancer. Lung cancer is particularly associated with a lot of stigma. Many of my patients do not feel comfortable disclosing the diagnosis to their family or their community because the first question they get asked is, do you smoke? And if he did, then it's felt that they deserve the cancer because of that. And that's very related to patients' cancer survivorship. If you feel you cannot disclose your diagnosis, then you have an additional burden on top of the cancer. Over 2 years, I treated this patient. We were very close, and eventually her husband learned about the diagnosis, but most of her family did not know. We worked with palliative care, we worked with psychology, and I saw firsthand how extensive, how permanent the stigma of lung cancer can affect our patients' survivorship. It was heartbreaking. Unfortunately, the disease progressed, and after many lines of therapy, no other options were, and she transferred to hospice. She dies in a short months after transfer to hospice, but something that really marked my life moving forward is that her obituary stated that she had breast cancer. She wanted that. She was so afraid of the stigma of lung cancer that even continued after her death. And that's what is very important to understand, the unique needs and the unique survivorship needs of every disease. And lung cancer stigma affects every patient and affects their daily experiences. When it comes to lung cancer, stigma affects delays in diagnosis. It significantly affects our patients' survivorship. It's associated with depression and anxiety. It's associated with a lot of isolation, communication challenges, and affects the patients and the physician's relationship and communication when there's so much stigma. The stigma not only comes from families and neighbors, it also can come from any healthcare provider, primary care doctors, medical assistants, and nursing. And that's why we all need to be aware that nobody deserves to get cancer. And the only thing that you need to get lung cancer is a pair of lungs. And last time I checked, all of us have at least one. Also, it's important to understand that diseases are changing. In the case of lung cancer, we are continuing to see younger and younger women having with lung cancer, being diagnosed with lung cancer. For the first time in history in 2018, now there are more younger women getting lung cancer than younger men. And this is irrespective of smoking behavior. So we need to understand the needs of survivorship for patients of the LGBTQ community, the needs of populations of color, recent immigrants, non-English speaking. All those needs and survivorship are different. I specialize in women with lung cancer, particularly younger women, and their needs can be very different compared to my other patients. So the survivorship plan in the survivorship journey is very dependent on many things that range from age, gender, socioeconomic status, ethnicity, cultural beliefs, and healthcare beliefs. There are significant stigma and cultural difference when it comes to lung cancer, and especially when it comes to cancer survivorship. For some patients, I have an abuelita, which is a Hispanic grandma, who's very important for her is to be able to do the dinners for her family on Sunday. So we have scheduled chemotherapies on Monday because she feels the best the day before chemotherapy so she can cook for her family. That was how she expressed love. That is important to her. That's part of her survivorship journey. For my other patient, running is very important. So we had done many things to make sure that she'd still be able to run. So you can see the differences in healthcare belief and survivorship, and that's what survivorship plans should be targeted to our patients' healthcare belief. We're moving targeted therapy, particularly in lung cancer, to early stages. So patients now are receiving targeted therapy or a chemo pill for around 3 years or more, and that's changing survivorship because these patients were found to have surgery, they get 4 cycles of chemotherapy and they will be done. But now they're having targeted therapy for up to 3 years. And there are many challenges. Do the stage 1 patients should go on this or were they cured? Do we really have to submit these patients to therapy for a whole year? We still don't have long-term data to see if this is the best approach. The financial toxicity, the fertility needs are part of survivorship, even for patients that have early stage. Long-term toxicities, we're committing patients to treatment for 3 years. Do we really know this new onset of survivorship and how that will affect our patients? And particularly cultural differences, how patients with early disease, we see survivorship, what is important to them, what can we do for them? And it's important that we change the focus in cancer survivorship from the maximum tolerated dose, that's something that we used to do in which the patient will take as much chemo as they can, to quality of life. And that's where understanding our patients' healthcare belief is very important. We're seeing more and more studies like this study that are showing that sometimes more is not better. And these studies show that patients that were getting daily radiation for small cell lung cancer have a better quality of life than patients that were getting it twice a day, despite having equal outcomes from the cancer. So we're doing more and more studies to understand the survivorship needs. What matters to our patient, what is important is really related to healthcare belief and cultural differences. Something I want to talk to quickly is about sexual health. Sexual health is a very important aspect of survivorship that's often neglected. We conducted the SHOW study, which is the Sexual Health Assessment in Women with Lung Cancer. It's the largest study today that evaluates sexual health in women with lung cancer. Many of the sexual health studies in lung cancer preceded the approval of some of the new drugs, and sexual health is often underreported and understudied. Around 95% of patients may have some degree of sexual dysfunction. And it's important to mention that the sexual dysfunction related to cancer treatment can persist over time, even after patients have received all treatment. And why is it important to address sexual health? First, sexual health is a way of communicating love to others, communicating love to ourselves. Sexual health is not only about penetrative sex, it also is related to masturbation or self-stimulation, kissing, cuddling, foreplay. So in the SHOW study, we conducted a survey through the lung cancer registry. We have validated questionnaire. We have over 240 participants. Most patients were around 50 to 60 years of age, all with lung cancer, and 45% were receiving therapy. What we found in this study is that 77% of patients have some degree of sexual dysfunction that was affecting their quality of life. We also found that many patients had decreased sexual desire or interest after lung cancer diagnosis, and the main issue was vaginal pain or discomfort. Sexual health is part of survivorship, but it's also important to understand how patients want to talk about sexual health. Everybody may feel comfortable to talk about different levels. We also learned that the survivorship needs of patients with lung cancer when it comes to sexual health are very different. The most common symptom they reported to be associated with sexual dysfunction was fatigue, compared to breast cancer, that's very different. Feeling happy, unhappy, or sad. Issues with a partner was 22% of patients, and shortness of breath, 15% of patients. So sexual health as part of survivorship, it needs to be addressed in a way in which patients feel comfortable with or without their partner. When it comes to this study, we concluded that sexual dysfunction is prevalent in women with lung cancer, and sexual health should be part of all conversations about survivorship. We have more and more cancer survivors. We need to target all survivorship plans based on their healthcare belief and their cultural preferences and how they see disease. We have been seeing changes in adverse events or side effects. No organ is safe with immunotherapy. There's a lot of stigma associated with some cancers versus others, particularly important for lung cancer. Healthcare beliefs influence survivorship. We are including more and more therapies in the early stage setting, so we need to know this as a new phase of cancer survivorship, and sexual health is oncology care. I hope this conversation has shown you how cultural beliefs, how healthcare beliefs will affect our patient survivorship, how lung cancer survivorship is changing, and how side effects and sexual health should take a very important role when we talk about survivorship. It has been my true honor to be with all of you, and I hope it has been educational as well as provided some information that you may not use today but may use in the future. My name is Dr. Narjust Florez, and I'm a thoracic medical oncologist at Dana-Farber. Thank you.